We also we have people that cover everyone in all 50 states. In addition to your lobbyists here, we have, there are people in every single state, and we coordinate with them extensively, as well as the National Coalition Conference of Insurance Legislators, the National Governors Association. We also coordinate with the American Academy of Actuaries. I just talked with them this morning about reinsurance provisions. So some of the things that are helpful from you to back us up in this whole process, we have reinstituted our grassroots initiative program. I know you've seen that in the Washington update. The amount of resources we're spending on government affairs is just unbelievable right now, and I assume you want us to continue to do that. We have to do it. It's pretty critical. And HAHU, you all know about our political action committee. It matters who gets elected. I mentioned Operation Shout. I cannot stress this enough. When you get things that we ask you to distribute to your clients, please look at them closely, and if you're okay with what it says, personalize it yourself. It doesn't have to be from us. We just want the information to go to your clients. And we want to make sure that you're keeping them informed about what's going on. Also, those of you, we are very much, and I have to admit that I don't understand how all this works, but we're on Facebook and Twitter, and I think we have a Skype account. I don't know what all this means, but the other people in our office do. I don't do it. And I know some of you are really big into that area. And we also have our own social media through NAHU as well. The other thing, and my little homework for you, in addition to watching for Operation Shout, is that I'd like for you to really watch what's going on in your local newspaper. When you see something that is not correct, please respond with a letter to the editor. And if you need help writing the letter, we have a department of people that will help you do that. We have been unbelievably successful with op-eds, editorials, and letters to the editor in the last year. And the opinion media is the first thing your member of Congress looks at every day. So they want, the reason why, people who write letters to the editor are politically active, right? And so they want to know what those people are thinking. It's very important. And lastly, if any of you are interested in if you have radio connections, we do have a new public service announcement. We've been getting a lot of play on it across the country. You may not be aware of it. We want to make sure and take advantage of it. If you don't know how to get it, just ask me and I'll make sure you receive that. So thank you very much.
Did we want to take some questions before 5 minutes?
Oh, sure.
True to form, when I run a meeting, we're a little ahead of schedule, and Janet is going to be able to take questions for about 5 minutes.
Yes.
Janet, where did the law come from that says that Medicare is going to push doctors' fees down 10% per year, and why in the world would Republicans be in support of something like that, if they are? But it sounds like they are.
Well, did you all hear that question? You know, this issue about the doctor fixes and do we pay doctors enough money? That's the question. And where did that come from? Well, it was written into legislation a long time ago, and it was designed to cut costs over time. The idea was that it would push doctors into efficiency. Republicans aren't really for it. They just don't want to fix it the same way that the Democrats want to. You know, and this is, I'm glad you asked that question, because I need to add a little political context here. The big race to get something done this year on health reform or the doctor's fix is political primarily. And that's because once you get into the next year, will be in an election year, then nobody wants to let anybody have any wins on anything. So the Democrats don't want the Republicans to, the Republicans don't want the Democrats to. That's politics, that's the way it is, and that's why it's a big hurry to get it done this year. If I had my crystal ball, it probably will happen this year, but it could push into the first quarter of 2010, but not beyond that. So something's going to happen, I would say no later than the end of March of next year, and it'll probably be 2009. It's really all politics. Actually the Republicans don't really want us to be, the government to be saying how much the doctors get paid. That's anti-Republican philosophy. So it's just a matter of, it's politics. It's an ugly answer, sorry. Mike?
Can you clarify your comment about why people will not be able to keep their existing insurance? Can you expand on that a little bit?
Yeah, the reason why people, Mike asked, why can't people keep the coverage they have? And the reason for that is that the grandfathering provisions, depending on which version you're looking at, say that if you make any changes at all, for example, you change your deductible, your co-insurance, which people do this all the time, you know that, then it's no longer considered a grandfathered policy. And then in addition, in some versions of the bill, they say, well, you can keep the benefits in your current policy, but after a certain period of time, the new rating provisions will come into play anyway. That's why. Travis?
If I heard you correctly, you said about midway through that this is going to pass, we're going to have change, all of the health insurance as we know it is going to go by. And if that's the case, if I heard you correctly, what is going to be the role of the agent at that point from the group standpoint as we've done?
Well, I didn't exactly say it's all going to be completely different. So we're still going to have private coverage like we have today. And all of you guys, carriers that are in the room are going to be around most likely. The rules for how the coverage is sold will be different. What will change is that in the individual market, for example, there won't be any more health questions. The way coverage is rated, there won't be any whole status rating in any market. Coverage will be based on age, and then depending on which version of the bill, there might be broad rate allowances or really narrow ones. And that'll be it. And the way that costs will be adjusted will be internal through a system of risk adjustment. And secondly, in certain markets, some of the coverage, not all of it, will be offered through a health insurance exchange or gateway, depending on what it's called. And agents will be allowed to sell that too. They're specifically written in to the legislation. So people are still going to have choices. They're still going to need your assistance. And by the way, who knows better than you all that what you do is not just help people get their coverage. One of the things that we've been very successful in getting the information forward is how much you do for your clients that has nothing to do with placing the coverage. And they do not want that to go away. They do not want that to go away. So you're definitely included. The success in keeping agents and brokers in has been phenomenal. I didn't think that we would be this successful in keeping you in at this level, to be honest. So I think there'll be a big role. And the main thing is that we want to make sure that things don't happen that damage the private system. And so we don't just look at the agent broker provisions. We look at the other provisions that would damage the private system that would get at your role a different way.
That's all we have time for. But Janet, thank you. And on behalf of all of us, we want to present you with this token of our appreciation.
Thank
you
you,
can add
sir.
it to your collection, I'm sure.
Thank you.
And thanks a million for coming.
Thank you.